Hello, and welcome to the Association Health Plan Frequently Asked Questions. My name is Wendy Block, and I am one of the Senior Account Managers here in the Benefits Department at Professional Insurance Programs. We are the exclusive agent for the Association Health Program. Today we're going to be going over frequently asked questions. This is hopefully going to help you through the process of quoting and underwriting for the Association Health Program. The first question is, do I have to wait until the beginning of the year to establish a group health plan? Not at all. You can establish a group health plan at any point throughout the year. That is really nice because we do have a lot of potential clients that are actually off the January 1st enrollment period. So if it's February, March, July, August, you name it, we can do it at any point throughout the year. The next question is, who is considered eligible for the plan? We define eligibility as someone who is full-time under the Association Health Plan as 26 or more hours per week. This can be modified to up to a 30 to match your employee handbook if need be. How much does the employer have to contribute to the employee's premium? While we recommend that an employer pay at least 50% of the premium, this is only a suggestion. Employers have the ability to designate how much they contribute, if at all. This is a very unique feature to the Association Health Program. Many times, other carriers, especially those that are under the Affordable Care Act small group market, have a minimum contribution of 50% towards the single. While again, it is a recommendation for us, it is not mandatory. What if all of the employees waive off the coverage except for one? You can establish a group of one as long as you have a valid waiver from other eligible employees, keeping in mind that if someone loses coverage or if you have a new hire, they must be offered the practices coverage. This is again another unique feature in the Association Health Program. Again, many other carriers state that you have to have a minimum of 2 enrolled to make a group health insurance plan. Here, we can do a group of 1. As long as there's 2 eligible and we have 1 waiving and 1 who's enrolling, we can write a group of 1. What is the difference between single, limited family, and family? The single is your employee-only coverage. A limited family is going to be an employee and spouse or an employee and child or multiple children. A family, full family as I say, is 2 parents and a child or multiple children. Am I able to offer multiple plan options? The answer is yes, you can. You are able to elect up to 4 different options to fit the needs of your employees. You must have an employee in each option that is elected. So again, this is very unique to the Association Health Program. Even if there's only 2 of you enrolling, you can still have 2 health plans, one for you and one for the other employee. You can do a combination of PPO copay plans and our high deductible health plans. So it doesn't have to be all copay plans or all high deductible health plans. You can choose any combination you are comfortable with. What if I offer the plan to my employees and my employee spouse has coverage that includes a spousal carve-out rule? An employer that offers a self-funded plan may have this rule in place, as this type of plan is not overseen by the Office of the Commissioner of Insurance. If an employee spouse has this type of plan coverage in place, then your employee must take the coverage that is being offered through your business. Sometimes spousal carve-outs are also known as spousal waivers. They can also include things like an increase in premium as well. So if you have questions on spousal carve-outs, don't hesitate to contact our office. Are the enrollments underwritten? Being that this is an association health plan, all applicants will be underwritten to determine final rates. So when you contact our office, the first step is what we call a preliminary rate. That is a rate solely based on your census data. From there, if you want to move forward, you will receive what is known as a final rate by having those who are interested complete an application with health history. There's no physicals or no blood work or lab work required, but it is an application with health history. This is used to determine what the final rate will be. Can our group be declined? No, it cannot. With large group association health plans, a carrier cannot decline coverage. However, depending on pre-existing medical conditions, the underwriter may impose a rate increase. This is why we talk about preliminary versus final. So I get the question all the time, what is the potential rate up? That is solely based on the underwriter's discretion. It really depends on the medical history and prescription drug utilization as to what that final rate will be. Now, pre-existing conditions must be covered because that is an Affordable Care Act rule. But again, it's a matter of what is the rate going to be to cover those pre-existing medical conditions. Why is the rate for a single younger person the same as a mature single person? Again, in a large group health plan, we use what we call a composite or blended rating rather than age rating like the 2 to 50 ACA community age rated plans are. So all singles, regardless of gender, pay the same premium. This will be the same for limited families and families as well. So in a composite or blended rating situation, it's nice because you can also set your contributions based on a single rate rather than age rated and trying to determine how much to contribute if it's a flat dollar amount. Is there network coverage out of state? The answer is yes, there is. There is a network wrap that is tied to out-of-state coverage through First Health. First Health is the network that we access with WPS for the Association Health program. What if I offer a plan to my office? What happens to those individuals that are receiving subsidy? This is a great question. We get this one often. If you are going to offer a group health program or the association health plan to all of your eligible employees, if someone is on the marketplace or exchange and they are receiving a subsidy and they waive their right to the health insurance program, they will also no longer be eligible for the subsidy. Is preventive care covered at 100% like it is in the Affordable Care Act plans? The answer is yes, it is. Preventive services are paid at 100% as long as you have them done by an in-network provider. Preventive care services are going to be that annual routine exam. It's going to be things like lab work or blood work that is tied to that annual exam, as well as things like mammograms and potentially a colonoscopy. Again, with colonoscopies, it comes down to coding. Okay? How do I request a quote? To request a quote, you can contact our office directly at 800-637-4676 or contact us via email at info@profinsprog.com. That is short for Professional Insurance Programs. Can I get this plan with another agency? Professional Insurance Programs is the exclusive agency for this association health program. So as I mentioned in the beginning, we are the exclusive agency. You will need to work through our office to obtain quotes and final rates. All right, if you have any additional questions, don't hesitate to reach out to our benefits team here at Professional Insurance Programs. We will be more than happy to spend time answering any additional questions you may have, as well as do any sort of review of your current policy and analysis as to how it might compare to the 12 options that we have available. I would like to say thank you again for joining us today, and have a good day.